Do you suffer like this from back pain? Have you stopped running because of the arthritis in your knees? Afraid to go to the gym because you're going to flare up that injury again and not be able to work out? Did you see a doctor? What did they do for you? Did they give you pills? Did they send you to physical therapy? Have you had any imaging done? Have you had an MRI? Did you see a specialist? What did they do for you? Have you had physical therapy? Did any of these things work for you? Do you still have pain? Do you still have disability? Do you still lack the ability to do the things that you love? That was me a few years ago. I had a problem with very severe back pain that was debilitating. I was unable to work for several months. I went through all the traditional therapies for back pain, had epidurals done. I got temporary relief, but none of it really worked permanently. Eventually my condition continued to deteriorate and I needed to have surgery. After the surgery, my pain was relieved, but that really never addressed the cause of why I had the back pain. So after a couple of years, the symptoms started to return again. I started having more and more pain episodes. The pain was radiating down my leg. Fortunately, during that time, I was learning about regenerative medicine, prolotherapy, PRP, stem cell. I'd started a training program where I was learning to do injections, and about a year ago, I had a PRP injection done in my spine, and that made a world of difference. Several months later, I was able to go back to the gym to start working out, lifting again, and now a year later, completely pain-free, fully recovered. So now I have been trained to do these procedures, and now I have my own patients, and I'd like to share the experience of one of my patients with you now. So I was able to help this patient. She was very reluctant to do surgery. She works in the medical field, so she knows, the outcomes of people that get surgery. The outcomes are not really good. There's a lot of complications that can be associated with it, a lot of risk. I work in the emergency room. I see a lot of patients that have had back surgeries, and sometimes they work for a period of time, but they eventually fail. Fortunately, there is another solution, a non-surgical solution to back pain with regenerative medicine. So we currently offer regenerative medicine as a treatment option for chronic back pain. Our process includes an individualized treatment plan. You get a very thorough assessment to establish what the cause is of your pain, any underlying deficiencies as far as like nutritional deficiencies or limitations in your physical abilities or your strength. We want to address those issues. We do a thorough review of all your imaging studies, and then we come up with the treatment plan, and that starts with one, lifestyle. Make sure you have optimized your health and your physical fitness. We offer diet programs to make sure that you're optimizing your nutrition. We have supplements that we give you to make sure that your body has the best chance for healing itself after the procedures. And then we actually do a procedure where we inject PRP, which is platelet-rich plasma, into the areas where there is chronic injury or damage, and to promote healing. There is hope. There's hope for you, as you can see from my own experience and the experience of my patient and her fantastic recovery, my great recovery. So we'd like to help you. So call now, make an appointment, and schedule a consultation with me, and we can get the healing process started for you. If you're still not sure, then click the link below, and then we can send you a packet with additional information about this life-changing therapy.